Chaturmukha Samarambham, Vakphatacharya Madhyamam, Asmadacharya Paryantam, Vande Guru Paramparam. Paying salutations to all the Acharyas of Ayurveda who has devoted their life in enriching this science. I begin my presentation titled SNEHANA SWEDAS commonly practiced in Kerala. So my presentation, the contents of my presentation includes an introduction, Keraliya Chikitsa Kramas, SNEHANA and Swedana, different types of SNEHANA and Swedana, general guidelines and discussion. So Panchakarma, the Panchakarma is first mentioned by Acharya Charaka in Charaka Samhita Sutrasthana second chapter, that is Apamarga Tanduliya Adhyayam. There he mentions that Tan Upasthita Doshanam Sneha Svedopapadanehi Panchakarmani Kurvita Matra Kalo Vicharayan. He mentions that after performing the Sneha Swedas, Panchakarmas may be adopted in Upasthita Doshavastha with due consideration of dosage and time. Panchakarmas are shodhana procedures performed mainly to expel the vitiated doshas from the body. It is believed that the disease treated by shodhana will never recur, whereas those treated with shamana will recur in due course of time. Shamana given after proper shodhana may help in eradicating the disease completely. Doshaha kadachit kupyanti jita lankhana pachanehi jita samshodhanayar na tesham punarudbhava. Charaka Sutrasthana, it is the reference is given. In case of samshodhana, the total course of treatment procedure is mainly classified under three headings of Purva Karma, Pradhana Karma and Paschat Karma. Purva Karma includes Deepana Pachana, Snehana and Swedana. Pradhana Karma includes Vamana, Virechana, Niruhavasti, Nasya and Rakta Moksha. And Paschat Karma, which includes Samsarjana Karma, Shamana and Rasayana. So the Purva Karmas are generally done, they are generally started with the Deepana Pachana. Deepana Pachana, they do the Ama Pachana and the Deepana medicines what is given, it will do the Agni Deepti, which is very much necessary for doing the Sneha Pana. As the Deepana Pachana, it enhances the Agni Bala and it improves the Jarana Shakti and Abhyavarana Shakti. And Snehana Swedana, generally it is done before the Shodhana Karma. It is very much necessary, and in this presentation I would like to discuss Snehana Swedana, which is done externally and which has been modified by the Acharyas of Kerala, and they have named it as Keraliya Chikitsa Krama. So I would like to discuss about Keraliya Chikitsa Krama, which are the modified form of Snehana and Swedana. Snehana, the definition is like that. Snehanam Sneha Vishyanda Mardavam Kleda Karakam. Snehan is that which produces unction, oozing, softness and moistening, and Swedana is Tampha Gaurava Sheetaknam Shvedanam Sweda Karakam. Swedana produces sweat and it alleviates stiffness, heaviness and cold. Acharya Charaka included both Snehana and Swedana under the Shad Upakramas, where they are described as principal methods of treatment. Moreover, they have been considered as Bahiparimarjana Chikitsa, Upadhis among the Shodhana Chikitsa for expelling the vitiated doshas. If you see the mode of action of Snehana and Swedana, it is mentioned that Sneha Klinna Koshtaka Dhadukava Sroto Lina Yecha Shakhasti Samstaha Dosha Swedeiste Dravikritya Kostam Neta Samyak Shuddhipar Nirhriyante. The vitiated doshas lodged in Koshta, Dhatu, Srotas or in the Shakhas attain the Klinna Avastha, and the Swedana followed will liquefy them and thus reaches in the Koshta. The Shodhana procedure followed by this will expel them out. Acharya Delhana has mentioned that when Sneha Dravya reaches a particular dhatu, it subsides the disease of that particular dhatu. Virya of the drugs present in the abhyanga, parisheka, etc. gets absorbed into the skin through the Raumakopas or sweat pores and gets digested by the Prachaka Pitta. Moreover, some more references we can see in Charaka Sutrasthana, where they are mentioning the importance of Snehana and Swedana. Shushkanyapihi kashtani Sneha Svedopapadanehi namayanti yathatnyayam kim punarjivito naran. It is mentioned that by the application of oil or by after Snehana, which is followed by Swedana, even the dry stick becomes soft and elastic. Then what will be its effect in a live human being. That shows the much more effect of Snehana and Swedana when even if it is done externally. Next, we will see the classification of Snehana. Snehana and Sweda, it can be classified as Bahya and Abhyantara. Bahya means external and Abhyantara, which is internal application. Bahya Snehana, which includes Abhyanga, Padakhada, and Murthni Taila, where Abhyanga and Padakhada is discussed in this presentation. And Abhyantara Snehapana, which is being not discussed in this presentation, even though, but it includes Snehapana, Vasti, and Nasya. Classification of Swedana. Swedana is generally classified under 4 headings, which is Tapa, Upanaha, Ushma, and Dravya. This fold classification is done by Vakpata and Sushruta, and apart from that, from these 4 classifications, we are discussing Ushma Sweda and Drava Sweda. Ushma Sweda, which contains Pinda Sweda, Samstara Sweda, Nadi Sweda or Kshira Duma, Khanashma Sweda, Kumphi Sweda, Kupa Sweda, Kuti Sweda, and Jendaka Sweda. Among this, we are discussing mainly the Pinda Sweda. Pinda Sweda, the name is given by Acharya Vakpata in Ashtanga Sangraha. Pinda Sweda, which includes Valika Sweda, Churna Pinda Sweda, Karisha Pinda Sweda, Tusha Pinda Sweda, Thanya Pinda Sweda, Jambira Pinda Sweda, Patra Pinda Sweda, and Shashtika Shali Pinda Sweda. All these things we are discussing in this presentation. Drava Sweda, which is having a 2-fold classification, that is Parisheka and Avagaha. Parisheka, we are discussing Parisheka only in this presentation, which is again having a 2-fold classification that includes Thara and Pirchil. Thara is having a mainly of 4 types, which what we are discussing today. It includes Thanyamla Thara, Kshira Thara, Kashaya Thara, and Sneha Thara. Next, if we classify the Swedana, it is by the usage of Agni, we can classify it as Agni Sweda and Anagni Sweda. Anagni Sweda, we are not using any external, we are not using Agni. And again, we have a 2-fold classification, that is Bahya and Abhyantara, internal and external. Samshamana and Shodhana Purva Swedana, we are performing. And one more classification is Ruksha, Sniktha, and Sniktha Ruksha. These 3 Ruksha, Sniktha, and Sniktha Ruksha classifications can be found mainly in case of Potala Sweda, what we are discussing today. And we can also, by the mode of application, we can also classify them as Ekanga and Sarvanga. Ekanga means locally done Swedana, and Sarvanga means Sarvadehika Swedana. So today we are discussing the Agni Sweda, which is done externally, and which is done for Samshamana Karma, and Ruksha, Sniktha, and Sniktha Ruksha type, and locally done, and Sarvanga Sweda we are discussing in this presentation. So even though the Samshodhana is we all know that Samshodhana is an elaborate process. Many a time Ayurveda treatment was limited to Samshamana process, or we can say that the physicians were mainly concentrating on the Samshamana process, and this made the ancient physicians of Kerala to undertake a Herculean task of revolutionizing the neglected aspects of Samshodhana, and they started modifying the Snehana and Swedana procedures, and they have evolved into a 5-fold classification, which was named as Keraliya Panchakarma. It includes Shiraseka, Kayaseka, Pinda Sweda, Lepa, and Lepa. These procedures are, even though they are not doing any sort of Shodhana, and they are mainly doing the Samshamana Karma, by taking, as they are classified as 5 karmas, they have been named as Panchakarma. Here they are not doing Shodhana, and they are doing just Shamana and a little bit Shodhana they are doing. So here Shiraseka, it is mainly we are we can correlate with dhara. Kayaseka means pirichil or pirinju tadaval, what we are practicing here. Pinda sweda, they have mentioned that Pinda sweda, they denote Shastika Shali Pinda sweda. Annalepa, they is been used for Shastika Shali Annalepa. All over the body, it is done in for children especially. Shirolepa, it is the name is given for Talapodichil. So these are some of the contributions of ancient physicians of Kerala to the Ayurvedic literature, especially in Panchakarma. Chikitsa Sangraham is the first book which was published by the founder of Ayurveda, Vaidyaratnam P.S. Warrior sir. He has wrote this book and published in 1905, and in 1902 Ayurveda was established. And in this book, he has mentioned many of the Panchakarma procedures.
Dr. Krishnakumar Naik.
Yeah.
Certain people who are not able to hear, it seems. I just wanted to ask if everybody else is also having the problem, or is it only specific? Dr. Rajkumar.
Sir is audible quite well.
Okay.
Sir is audible.
Okay, that's good. Okay, Krishnakumar Naik.
Yeah.
Thank you. Thank you.
Yeah, so Chikitsa Sangraham, it was written by our founder, Vaidyaratnam P.S. Warrior sir. In this book, he has given many references, many way of doing many Panchakarma procedures. He has mentioned about Keraliya Panchakarma special treatments he has mentioned. And a majority of the portion he has taken for giving details regarding the Aushadha, or formulations what Ayurveda is preparing. So Chikitsa Sangraha was written in 1905. Next, the Dhara Kalpa, which was authored by Kaviraj Sukhadeva, that was also in Malayalam language. This Chikitsa Sangraham is available now in, actually the original was written in Malayalam, but now it is available in English and Hindi. Dhara Kalpam was written by Kaviraj Sukhadeva. So that was written in Malayalam language, and Keraliya Chikitsa paddhati, a book was written by Pavana J and Dr. Manoj Shankaranarayanan. It is available, which is based on this Dhara Kalpam. Sirakadivithi, written by Putiyadatta Raman Menon in 1929. There he has mentioned regarding this Keraliya Panchakarma, and he has mentioned all these 5 types what I have already mentioned. Vasti Pradipam, written by Panavalli Krishnan Vaidyan in 1932. The 5th book is Ayurvedic Treatments of Kerala, which is supposed to be the first book in English, which was written by Vayaskara N.S. Moose in 1944. Panchakarmam Athava Shodhana Chikitsa, that was written in Malayalam by Manakkodan Keshavan Vaidyar in 1949. So in that book, he is discussing all these procedures by giving some examples, or by giving his own experience in treating these patients with all these procedures. So that is an interesting book which was written in 1949. So next book is Keraliya Panchakarma Chikitsa Vijnanam. It is a compilation of collections of Vaidyanath Raghunath Sharma. He is supposed to be a disciple of Vaidyaratnam P.S. Warrior. Keraliya Chikitsa Krama, a book written by Vasudev Vilasam, and one more book published by Ayurveda Publication Department is Panchakarma Chikitsa Sara Sangraham, written by Dr. K. Rajagopalan. And finally, I would like to introduce Karma Parijayam, a book written by Vaidyabhushanam K. Rakhavan Tirumulpad. Now, if we see a comparison on classical and Keraliya Panchakarma, the classical Panchakarma mainly does the samshodhana of the vitiated doshas, and it mainly does the lankhana karma. So here in classical Panchakarma, the snehana and swedana are mainly done as purva karmas, where snehana is done as snehapana after the deepana pachana karma, followed by the shodhana karma. And classical Panchakarma, the internal administration of drugs is done and doshas are expelled out. And it is moreover dosha pratyanika. And here the ati hina and samyak yoga of are clearly mentioned. But in Keraliya Panchakarma, the ati hina and samyak yoga are not clearly mentioned, and it is moreover a yukti based procedure. Which means the person who is doing this procedure, he can decide whether when to stop this procedure. And Kerala Panchakarma, it is a samshamana procedure, but even though it is samshamana, it does some sort of shodhana that we will discuss later. and it is moreover Brahmana and Lankana. And here the Snehana and Swedana, they are the Prathana karmas, not the Purva karmas. They are the Prathana karmas, and the Paschat Shothana, a Mrudu Shothana, which is done with the Pati Kashayam or Gandharva Hastadi Kashayam. That is a Mrudu Shothana is given after this Prathana karma. That Mrudu Shothana is considered to be the Paschat karma. And medicaments in Keraliya Panchakarma, it is directed from exterior to interior. It is a Vyati Pratyanika. Vyati Pratyanika is comes under the Keraliya Panchakarma. So if we start the procedures, abhyanga, if we start with abhyanga, the literary meaning of the word abhyanga is movement of hands in various directions. It is mentioned, abhyanga is mentioned in the Dinacharya Adhyaya, where it is defined as abhyangam acharet nityam sa jarashrama drishti prasada pushtyayu swapna sutwapta dharthikrit shiraha shravana padeshu tam visheshena shilayet. Though it is mentioned, abhyanga is mere the application of, abhyanga is mentioned as mere application of oil, which involves, it involves the therapeutic consideration of such as dosha, dhatu, and appropriate selection of oil. But Acharya Sushruta, he has talked about samvahanam, which is giving which is also done by application of oil, but we are giving some sort of pressure. So that is mentioned as Samvahana by Acharya Sushruta. He has given the properties as Pradinidra Vrishyam Kaphavata Shramapaham Samvahana Mamsarakta Prasadakaram Sukham. So he has mentioned the gunas or benefits of Samvahana there. So it is done, this abhyanga or samvahana, it is done as a sarvanga or whole body or ekanga. Ekanga, it is done as mukhabhyanga, shirophyanga, padabhyanga, and mukhabhyanga mainly it is done before nasya karma. Likewise, it is done as locally, and it is done also as sarvanga or whole body abhyanga is also done. The contraindications of abhyanga, which includes ajirana and kaphagrasta avastha, and after shodhana it is contraindicated, which means if a person is doing is done with a shodhana karma, we have to give abhyanga only after the samsarjana karma, and before samsarjana karma abhyanga is contraindicated. And a mild rukshna before the snehana is more beneficial, as a mild rukshna before done before the sneha karma, it helps in more absorption, or it helps in giving more benefit of the snehana karma. And it is mentioned that while giving the pressure in kaphaja rogas, it is better to give more pressure for the massage, whereas in vatika rogas much pressure is not required. And the generally used medicines for abhyanga includes Thanantaram Thailam, Kottanchuka Thailam, Prasaranyadi Thailam. These all should be selected as per the diseased condition. So abhyanga is done using the bare hands, whereas padaghata is also a type of abhyanga, where pada is used for applying the oil. So this padaghata is mainly, we can see, mainly done for the swasthas, and it is a part of the Kalari Marma Chikitsa, and it is done in the during the Kathakali training program, and especially in the monsoon season, they are doing this padaghata for a month. So we are having a Kalari training institute here called PSV Natya Sangam. So we have been there for seeing this Pathagada treatment. So a difference is that after first they will be applying Tila Taila all over the body, then the person will be doing some exercise like for about 30 minutes, and later on they will be starting doing this Padakhata. So that time the person will be lying in the ground, and the person who is doing this padakada, he'll be standing nearby him, and he'll be holding a rope which is tied over his head for getting the balance, and he is using his pada, which is devoid of cracks and other skin related ailments. He is using his pada for doing the massage. So that time he will be applying more pressure. He can apply more pressure, and this type of padakata is done in Kathakali, as they have to maintain this posture during their performance. They have to maintain this posture for a long time, so they require these sort of pressured massages, and which they are getting by doing this padakata. So these are the commonly practiced Pinda Swedas in Kerala, which includes Valaka Sweda, Levana Sweda, Busa Pinda Sweda, Karisha Pinda Sweda, Churna Pinda Sweda, and Thanya Kiri. So these all things, they come under the Ruksha type of Swedas, whereas Jambira Pinda Sweda, Patra Pinda Sweda, they come under Sniktha Ruksha Sweda, or Jambira Pinda is more Ruksha than Patra Potala Sweda, and Shashtika Pinda Sweda, which is Brahmana in nature and which is more Sniktha. Shashtika Pinda Sweda is Brahmana in nature. Apart from that, some special potlis what we are practicing in Kerala, which includes Manjal Kiri, Godambu Kiri, Ulli Kiri, Mutta Kiri, and Sanni Kiri. And these all things we will be discussing now. So what is Ruksha Sweda? Ruksha Sweda, it is generally indicated as a Purva Karma of Sniktha Sweda. In Kapaja Vikaras or Ama Anubandha conditions, we have to practice Ruksha Sweda. And it is also mentioned that it should be, it is mainly done in swelling in the joints, Kati Shula, Grithrasi, and Amavada like conditions. This Ruksha Sweda, it is contraindicated in Antikrisha persons, Kevala Pitta, Kevala Vata, Bala, and other skin related ailments. This Ruksha Sweda is contraindicated. So this Ruksha Sweda, which includes Valika Sweda, Levana Sweda, Busa Pinda Sweda, and Karisha Pinda Sweda. Valika Sweda is the easiest method of Ruksha Sweda. It comes under the Ushma Sweda. Here, the roasted sand is made into a potli and is applied over the body. And it can be heated intermittently. It can be heated, and sometimes it is mixed with salt, and it can be done as only using Valaka, or it can be done after mixing it with salt. And it is generally indicated in Amavata and other Kaphanuvanta Vata Rogas. Next is Lavana Sweda. It is a type of Tapa Sweda, which is mainly indicated in Kapha Adhika Vata Roga, anti-inflammatory conditions, Vada Kandaka, and Santhi Shula. So Tapa Sweda, here more importance is given for the heat, what the patient is getting from. And in Lavana Sweda, the rock salt or crystal salt is generally used. It is these two things are taken, and it is made into a pottery form, and the Lavana Sweda is carried out. Then next is Busa Pinda Sweda, and Busa or Tusha is rice bran. It is not easily, I think it is not much easily available nowadays, but these things are also practiced in case of Sarvanga Vata, Pakshakhata, Ardita, and Uristambha. And next, this Busa Pinda Sweda, it is also found that it is much more useful in children suffering from dyspnea or asthma. Here the pottery is heated and it is applied over the anterior chest region. So it gives some kind of relief from dyspnea and asthma. Next is Karisha Pinda Sweda. Karisha means cow dung or goat dung. So Karisha Pinda Sweda is also a type of Ushma Sweda, which is mainly indicated in Pakshakhata, Amavata, and Kaphaja Vata Shonita. Here, the dry cow dung or goat dung is used to prepare pottery, and it is done in mainly in three ways, or we can do this procedures in three ways. Like heated pottery can be directly applied, or the pottery can be applied after immersing in a tamarind juice, or it can be applied after immersing in dhanyamla. So these all things a physician can decide whether what kind of procedure he has to carry it out. Next is Churna Pinda Sweda. As the name implies, here the churna, mainly the churnas are used to prepare this potali, and mainly used churnas include kola kulathadi, kottam chukadi, and jatamayadi. It is a type of sniktha. We can perform this pinda sweda in both ways, sniktha or ruksha. Generally, it is a ruksha sweda, but if we apply oil over the body before performing this pinda sweda, or if we use the pinda sweda and if we perform the pinda sweda after dipping it in hot oil, then it becomes sniktha. So in both ways we can perform this churna pinda sweda. And next is Dhanya Pinda Sweda. It is a type of Sankara Sweda, and mainly it is Ruksha in nature. So here the commonly we are using the grains or pulses we are using for performing this Dhanya Pinda Sweda. So here these pulses can be made into a powder form, and we can make a potally, and then we can carry out the procedure. Or in some other conditions, that we can take these pulses and we can cook them, and we can make it into in paste form. Then also we can bring or we can make a pottery with that paste. Then we can practice this Churna Pinda Sweda. So Dhanya Pinda Sweda, Dhanya Pinda Sweda. Dhanya Pinda Sweda, it is generally indicated in Vata Vyathi, Gridhrasi, Santhigada Vata, and Katigraha. And there is one more type of Dhanya Pinda Sweda, which is Navadhanya Pinda Sweda, which is also commonly practiced here. And it is mainly indicated in Mamsa Shosha, motor neuron disease, cerebral palsy, and Parkinsonism. So next type of Sweda is Jambira Pinda Sweda. It comes under the Ushma Sweda. It is also an Agni Sweda. That means while doing the procedure, we are heating the potali. It is Ruksha, Tikshna, and is Shopahara in nature. So the main ingredients of this Jambira Pinda Sweda, which includes Jambira, Sainthava, Leshuna, Methika, Shatahua, Tila, Sainthava, Haridra, and Taila. So all these things are required for preparing this Jambira Pinda Sweda. So it is mainly indicated in Vata Kapaja Rogas, Nirama Shobha, plantar fasciitis, frozen shoulder, traumatic conditions, and it is contraindicated in Kapha Pittaja Vyathis. All these Pinda Swedas we can do as Sarvanga, or we can do as Ekanga Swedas. So Patra Pinda Sweda, Patra Potala Sweda. Patra Potala Sweda is comparatively less ruksha to that of Jambira Pinda Sweda, and it is also a type of Agni Sweda, Ushma Sweda, and as it is a Sankara Sweda. Mainly it is a Sniktha type of Swedana, and it is indicated in Vata Vyathis, Vata Dhikya, Vata Kapacha Vyathis, Paksha Khata, Apabahuka, and Ardita. So Pakshakhata, in Patra Pinda Sweda, we can use the generally used patras that include Arka, Nirgundi, Karancha, Thattura, Eranda, Chincha, Shikru, etc. So these along with lemon, coconut, Taila, Shatahua, Methika, Sainthava, we can prepare this Patra Potala. And even we can use single patras for preparing the potali. Like Eranda Patra we can use for Pakshakhata and Katigraha. Nimba Patra we can use for Twak Rogas, psoriasis, and lichen planus. In lichen while doing this Nimba Patra Sweda, we can use Nalpamradi like oils that are having action over the skin. For abhyanga we can use that type of oil. Next Nirgundi Patra Sweda we can do for low back pain. Next is Shashtika Shali Pinda Sweda. It is also a type of Ushma Sweda and Sangara Sweda. It is Sniktha in nature. It does the Brahmana, Swedana, and Rasayana properties. It is done in Kevala Vata and also in Nirama Avastha. So the materials required for preparing the potli, which includes Shashtika Shali, and Shashtika Shali is prepared in a mixture of Balamula, Kwatha, and Kshira, and the same mixture is used to heat the potli while doing the procedure. It is generally indicated in Atiruksha, Karshia, and those who are having low back pain, sciatica, hemiplegia, cervical myelopathy, and it is also indicated for children who are having Pear's disease, reduced mobility, muscular dystrophy, and emaciation, and post-polio residual paralysis. So the generally seen complications of Shastikajali Pinda Sweda, it includes shivering and fainting, which need to be controlled soon. So here are some of the special Pinda Swedas which are practiced in Kerala. It includes Manjal Kiri, Godamba Kiri, Kukutanda Sweda, or Muttakiri, and Sannikiri. So Manjal Kiri, it is Haridra. So the main ingredients of Manjal Kiri, it includes Sarjarasa, Haridra, Shatahua, Laja, and egg white. And it is mainly indicated in low back pain due to IVDP and some other spinal injuries. Godamba Kiri, Godamba is Gothuma that is used for this for preparing this potli. The Godamba Kiri is also done in a similar way like Shastika Pinda Sweda. Here also Godamba or Gothuma is prepared in the mixture of Balamula, Kwatha, and Kshira, and it is made into a potli form, and the same mixture is used for heating the potli while doing the procedure. It is mainly indicated in flaccid paralysis. Next is Ullikiri. Ulli means Palandu. So this Ullikiri is mainly indicated in Shushka arches, where it relieves the pain which is caused due to the arches, and it is a type of local swedana which is done near the rectal area. So this to prepare this ullikiri, we have to fry this ulli or palandu in krita and made into a pottery form. Then this procedure is performed. So next is muttakiri or kukkudanda sweda. It is also a type of sangara sweda. And it is Niktha in nature, and it produces Brahmana and Santha. It is Santhanakara. It is mainly indicated in Mamsa Shosha, Pakshakhata, Grithrasi, foot drop, wrist drop, etc. The ingredients of Kukkudanda Sweda, it includes egg yolk, lemon, leshuna, nimba taila, and Kolakulathadi churna. Next is Sannikiri. Sannikiri is also a type of Sankara Sweda. It is mainly indicated in Unmada and Apasmara, and it also relieves the unconsciousness, what is happening during the stroke. And the main ingredients of this Sannikiri is Shunti Churna, deer horn, Gairika, Kumari Swarasa, and Vasa Swarasa, then breast milk or goat milk, and Eranda Taila. So these are the ingredients of Sannikiri. We have published a paper in our journal Ayurvedic that it is this Sannikiri done with Bhagotara Churna. It is having excellent result in the treatment of autism spectrum disorders. So we have published a paper in our journal Ayurvedic. So next is Kshiradhuma. It is a type of Snigdha Sweda. Hello. It is a type of Snigdha Sweda which is done as a Nadi Sweda, especially. Hello.
Doctor, unmute you. Mute you.
Ready?
Oh.
Okay. So next is Shirathuma. It is a type of Snigdha Sweda which is done as Nadi Sweda. It is mainly done in Urthvanga Roga. The major indications of Kshiradhuma, which includes cervical spondylosis, facial palsy, trigeminal neuralgia, osteoarthritis of jaw, brachial plexus disorders, and Apabahuka, Vishwachi, Hanugraha, and Manyagraha. So here, generally the head is not subjected to sudation process, but if it is necessary, Nadi Sweda can be administered. So it is a process where in equal parts of milk and decoction of balamula are boiled in a closed vessel with a tubular outlet. Emerging vapors are inhaled through a widely open mouth, can be given to other parts of body after abhyanga. So one thing we have to, it should not be applied over the eyes. So eyes should be covered while doing this Shiradhuma. So next is Parisheka or Dhara. Parisheka or Dhara, it includes Shiraseka, which is done over the head, what you can see in the nearby picture. So next, the next is Kaya Seka, which includes Dhara, Pirichil, and Pirinyu Tadaval, what we will discuss now. Then it also includes Dhanyamla Dhara, Kashaya Dhara, Kshira Dhara, Sneha Dhara. Even though other materials like Nalikera Udaka, that all things are we are using for Dhara, but they are not producing swedana, it seems. So they have been not discussed, or they have been not included in this presentation. And this Dhara can be done as an Ekanga Dhara, or we can do as Sarvanga Dhara. So this Dhanyamla Dhara, it is a type of Dravasveta, and it is indicated in Vata Rogas with Kaphanubandha and Amanubandha, and it is also indicated in initial stages of multiple sclerosis, Vata Kapaja, Vata Rekta, as per Charaka. So here for doing the Dhara Dravya is Dhanyamla. So in case of Kashaya, the Kashaya Dhara, the Dhara Dravya is Kashaya, and the generally used Kashaya is Dashamula Kashaya Dhara, which is indicated in Kapanubantha Rogas, and it is also Vatahara. Next is Kshira Dhara. So Godukta is mainly used for doing the Kshira Dhara. Even Dharoshna Paya with the Shita Virya Davyas are being used for performing this Kshira Dhara. Dashamula Kshira Dhara is generally done, and it is done in Vata Prathana Vata Rekta, and Dashamula Sritam Kshiram Sadhya Shula Vinashanam. It is having the Sadhya Shula Haratva property. Next is Karaskara Kshira Dhara. It is mainly indicated in painful condition of the extremities. The Sneha Dhara, or it is done mainly as Taila Dhara. Even we can use a mixture of Taila and Krita, or Krita alone can be used for as a Dhara Drava. So here the Samskrita Snehas, like the formulations like Dhanvantaram or Karpas Astyadi, or likewise formulations are mainly used for performing this procedure. So this is next is Kaya Sekam, Pirichil, or Pirinyu Tadaval. So Kaya Sekam can be performed in two ways. The first one is Pirichil. Pirichil, it is a type of Dravasveda, which is Parisheka. So it is a combination of both Sneha Sweda and Sniktha Sweda. Means it is a combination of Sniktha and it is both, it is doing Snehana and Swedana. It is mainly indicated in Pakshakata, Vata Rekta, scoliosis and kyphosis, and is contraindicated in Amavasta. And generally these type of Swedana procedures are not indicated in Grishma Ratu. So the commonly used formulations that are used for Pirichil, it includes Dhanvantaram Tailam, Prabhanjana Vimardanam Tailam, Valiya Sahajaradi Tailam, Valiya Narayana Tailam, Kshirabela Tailam. So all these Tailas should be selected on the basis of the disorder. We can select all the what kind of formulations is required.
मोबाईल वर काही पण खेळत बसून
Hello. Yes, the commonly seen complication in Kaya Sekam, it includes fainting, burns, giddiness, fatigue, fever, and hypotension. So Kaya Sekam, here the more quantity of oil is required for doing this procedure. That means around 1.5 to 2 liters of oil is required for doing this procedure. And here generally in Pirichil, we are just squeezing out the oil which through a cotton, through a oil soaked cloth. and facing the thumb downwards. So in that way we are performing this procedure. And here the massage doing in between the procedure is very less. So in case of Pirinju Tadaval, the quantity of oil used is very less. So here more importance is given to the massage. That means oil is just squeezed and it is carried out by, then it is followed by a 5 to 10 minutes massage. So that is the difference between Pirichil and Pirinju Tadaval. Next is Anna Lepa. Annalepa is also named as Techirippa or Kali. So it is also Techirippa means we are just doing the lepana of this Anna, and we have to continue the lepana for about 30 to 45 minutes. We can continue this process, and it comes under the Ushma Sweda. It is also a type of Snigdha Sweda. It does mainly the Brahmana, and it is believed that the absorption is comparatively more compared to Shastika Shali Pinda Sweda. But there is an opinion that Shastika Shali Pinda Sweda is more effective than Annalepa. But both opinions we can see. And Annalepa we can indicate in all people like from like children, or we can indicate them in even for adults also. The main indications of Annalepa includes disease of nervous system, muscular dystrophy, motor neuron disease, muscle wasting, and etc. Next is Shirolepa or Talapotichil. It is generally done in case of psychosomatic disorders or dermatological conditions, and in patients having insomnia. It is a type of Anakni Sweda. That means here the Lepana, what we are using, it is not being heated. And as it is, it comes under the Upanaha Sweda, which means we are applying the Lepana over the serous, and it is covered using banana leaf after making a pit over the Brahma region, which is done just to keep some oil as talam. So the contraindications of the Talapotichil includes Amanubantha conditions. We are generally not giving this Talapotichil. The complications of Talapotichil, as it is very cold in nature, the complications includes Pratishyaya and Shirashula. Next is Talam, which means keeping Sneha mixed with Kalka overhead. It is mentioned as Mastishkya in Sanskrit. Talam, I think it's a Malayalam word. So Talam is generally done as a Purva Karma of Patra Pinda Sweda, Pirichil, and Shastika Pinda Sweda. So commonly used Talam, it includes Kshirabala Talam, Venna Talam, and Nelikya Talam. Kshirabala Talam is mainly indicated in Vataja Rogas. Venna Talam is indicated in Ardita, and Nelikya Talam generally it is mentioned for psychosomatic disorders. The churnas what we are mixing with tailas, the generally used churnas include Panchagandha Churna, Rasnadi Churna, where Panchagandha Churna is mentioned for psychiatric disorders, Rasnadi Churna in Pratishyaya, Balamula Churna in facial palsy, and Kachuradi Churna in sinusitis. Ekanga Sweda, it includes Murtha Tailas, Abhyanga, Seka, Pichu Vasti, Netra Tarpana, Karna Purana, Griva Vasti, Uro Vasti, Kati Vasti, and Janu Vasti, which I am not going in detail. So the Netra Tarpana generally it is mentioned in visual problems, dryness, myopia, and commonly used drugs include Jivantyadi Kritam and Triphala Kritam. Karna Purana, it is generally indicated in Karnanada, where Apamarga Kshara Taila used, and Karna Shula, where Vilva Taila or Nirgundi Taila is used. And Grivavasti, we are generally Grivavasti is done in cervical spondylosis with Kshirabala Taila and Apabahuka in with Karpasastyadi Taila. Uravasti is generally indicated in Urakshata, and here we can use Thanvantaram Tailam, and in some cardiac illness where palpitation and pain is found, here we can use Kshirabala Taila and Thanvantaram Taila. Kativasti is generally indicated in radiculopathy, where we can use Sahajaradi Taila, and in mechanical low backache, where we can use Murivenna, and in lumbar spondylosis, we can use a mixture of Cotton Chukadi Churnam, Cotton Chukadi Taila and Thanvantaram Taila. Janavasti is generally indicated in Sandhigata Vata, and we can use Mahamasha Taila and Dhanvantaran Taila. And in ligament, some kind of ligament injury where Murivenna is generally used. So coming to the general guidelines which have to be followed during the procedures. The success of the treatment depends upon the procedure selected, methodology used, and the skill of the person who is doing the procedure. And the more and most required is the cooperation of the patient. So the patient should be counseled before the treatment, or even patient bystander has to be counseled. And next, we have to check all the vital data, which includes temperature, pulse rate, and BP breefore and after the procedure. Next, we have to carry out this procedure in a Nivata room where that much of breeze should not be there. And there is a practice that even though we are doing external SNEHANA and swedana, we can give some SNEHAPANA in a limited dose. And that means we can do abhyantara SNEHANA also. And we have to confirm that the patient has digested his food what he has taken in the previous day. And next is the time of administration of the procedure and the duration of the procedure, way of doing the procedure. And all these should be proper, and it should be according to the Vyathi, Vyathita, Desha, and Ritu. The generally mentioned time for carrying out all these procedures is 7 to 10 a.m. and 3 to 6 p.m. Preferably, the treatment is done in the Ashada, Ashwina, and Falguna Masa, and it is mainly it is better to avoid in the Grishma Ritu. And the duration for the treatment can be 45 to 1.5 hours, and generally it is done 7 to 14 days, and even the Pidchil, it can be done even for 21 days. So we have to, while doing the potli sweda, we have to ensure the temperature of the potli every time, and we have to encourage the patient whether the temperature is bearable to him. That the temperature of the potli we can assure by keeping the potli, heated potli, over the dorsum of the hand. So the therapy should be stopped if the patient gets samyak svinna, or even we can stop the procedure if the patient is having some sort of discomfort. And the most important thing is that if the procedure is done by a group of masseurs, that means sometimes 4 to 6 masseurs will be carrying out the procedure. So all they have to do the procedure in a synchronized manner. They have to do the procedure in a synchronized manner. And if you take the, while preparing the potli, it should have the size of half a coconut, and that means it should be weighing nearly 250 grams, and the potli should be firm, and it has to be prepared in that manner. Kshiraduma, we have to check, we have to ensure that condensed water vapor should not fall on the patient. Stream of the thara, while during the thara, it should be uniform and continuous, and the temperature should be maintained throughout the procedure. While doing the Sarvanga Thara, 6 positions have been mentioned in Sirasekadi Vidhi. Even we can do the procedure in 7 positions. It helps in ensuring that the procedure what we are doing, it has reached in the each part of the body, and even the thara, the sequence of oscillation, we have to do it in a synchronized manner. The complication, generally found complications, and its management includes the complications are 4 general, we can see 4 complications, and it includes burns, which can be managed by using by applying Shatata Udakrita, and fainting can be seen. So we have to stop the procedure. We have to sprinkle cold water, and Drakshadi Kashaya can be given for Pana. If the patient is having shivering, especially it is seen in case of Shashika Pinda sweda, then you have to use a thick blanket to cover his body, and we can give warm water for drinking. And if the patient is having rashes, we can apply Madhu and Krita, Shatadhuta Krita, or Murivena. Generally, talam is done as a purva karma, and paschat karma in Kerala there is a practice of giving patya kashayam. It is given before, or even we can give after the treatment. It mainly does the anulomana karma, or it does the virechana karma, and it also enhances the Agni. As in the yoga it is mentioned, Gandharva hasta chirivilva hutasha vishwa pathyapanarnava Yavaksha Kwathatali, Kwathamsa Saindava Gulam, Pavanasya Shandehe, Vanirbalaya, Malashodhanaya. Means it does the, it increases the Aknibala, it does the Vata Shamana, and it also does the Anulomana. Then we have to wipe after the procedure, we have to wipe off the talam and we can apply Rasnadi Churnam. We have to cover the patient with a blanket. He can take a rest for 30 minutes and he can have a hot water bath. So we have to advise patient to take Lakhu Ahara, and he has to he has to follow the Ushna Udaka Upachara, and he has to avoid day sleep, exposure to sun, breeze and cold atmosphere. And he has to strictly follow the Panchakarma and Parihara Kala, which is mentioned in the classics. He has to strictly follow. So if we come to the conclusion, only a few points are there, but in the case of research, we have the utility of various SNEHANA and swedana in the management of various disorders, both in the IPD and OPD level. Then next is scientific validation of folklore medicine so that it reaches in more hands. Means like what I was explaining in Kerala, these kind of practices. Similarly, many practices will be there in other sites also. These all things we have to we have to study all these procedures, and we have to document it. That will be useful for the coming generation also. And next is we can improvise these procedures using some modern techniques. That means for Kshiradhara, we can use an automated machine. That means for Dhara purpose, these kind of automated machines are available now. So that all things we can improvise the procedure in that all manner. Next is documentation, that which is very much important, and most of these procedures are yukti based. That means even you can alter this means you can while you can everybody is having the right to alter the ingredients, alter the way of doing the procedure. All these things you have according to your yukti, you can change all these things. So that is, and it is better if you can document all these things. It is better that you can do some kind of next is the cost effectiveness. That is the cost effectiveness is a major thing, and that for Pirichil, I have already told that it requires nearly 1.5 liter to 2 liters of oil. So the cost effectiveness is a main thing. And for that, if we are using Murchita Telataila, instead of there is a practice in some places that they are using Murchita Telataila for abhyanga, Pirichil, and instead of using some formulations. So that in that way we can reduce the cost of the treatment. And next, I'm having a doubt that Parihara Kala, which is mentioned, is it possible in the current scenario? That thing we have to think. And next is multiple Kriya Kramas, what we are doing nowadays, that a patient who is admitting in our hospital, that he will be having nearly 15 or 21 days of, he will be admitted here. So we are forced to do, sometimes we are forced to do multiple Kriya Kramas in that way. So is that require, or is that is causing any kind of complications? All these things have to be studied, and it should be documented in a proper way. I would like to conclude by saying that Abhyasat Prapyate Drishtihi Karma Siddhi Prakashini Ratnadi Sadasa Jnanam Na Shastra Deva Jayate. It is a quote from Ashtanga Hridaya, which means the vision that illuminates the achievement of the therapy can be acquired only through continuous practice. The knowledge regarding purity of precious stones like diamonds cannot be attained by scientific knowledge alone. This means that even though many things are mentioned in Shastra, we require continuous practice so that we can achieve the Karma Siddhi. For that, Vakphata has given the example that the diamonds like Ratnas, what is mentioned in the Shastras, he can only the person who is handling the Ratnas, only if he is handling regularly, he can identify whether they are pure or not. So Abhyasa is very much necessary while doing all these procedures. And finally, I would like to acknowledge my guide, who is Professor K. Murali sir. He is our chief editor of our publication department, and who has guided me in preparing these slides. And I also like to thank Dr. Nishant, who is also a part of this presentation, and also the marketing department of Ayurvedic Shala for giving me an opportunity. Thank you, and I would also like to thank you all audience for your patient listening. Thank you. The topic is now open for a discussion. Thank you.
Thank you, Doctor. Now the thing is for now completely this is open for discussion. Dr. Nishant will be leading the question answer session. So if you want to ask something, please either you can one by one you can unmute yourself, you can ask, or else you can type in the chat box.
Before anybody asks, let me first take up certain questions that has been already given in the chat box. That was coming, so I was noting them down. A few of the things I will be answering, but I think few of the things are relating to this presentation also. A lot of people have asked for a recording of this. I think
it's already there. For everybody's information, this is being live streamed through YouTube right now. So the link will be shared to our marketing executive. You can ask from him, he will give it to you. So it's okay.
So that part is covered. So the second part, Dr. Krishna Kumar Naik, if you are ready, I will just pass on certain questions to you.
Yes.
So that a lot of people were asking questions while this thing was going on. So one person had asked how to prepare Bhusa Pinda Sweda.
Bhusa Pinda Sweda.
Yes. That was, should I give the names of the people who have asked, or should I just leave the questions?
As you wish, sir. As you wish.
Okay, so just answer the question. I think the person knows. So let it be so. So how to medicines used? No, sorry. How to prepare Bhusa Pinda Swedam is one question. And this, the same person has asked another question. Difference between Dhanya and Navadhanya Pinda Swedam. I think the name itself is very evident. But
yeah,
anyway,
in that Navadhanya Pinda Sweda, it is Navadhanyas are used. And Dhanya Pinda Sweda, even we can use Chatahua, Methika, like things we are mixing up with the Dhanya pulses. So that is the main difference between Dhanya and Navadhanya. And Dhanya Kiri, we are have already told that it can be done as in the Churna form, and or it can be done as after preparing it, we can do the procedure. So in both ways, we can do the procedure. So Bhusa Pinda Sweda, so here the Tusha or rice bran is used to prepare the potli. Tusha or rice bran. Generally, it is not practiced, but a book, it is very difficult to get the rice bran. So I think here we are not practicing, but it is mentioned in a book called Kirigal, in a book called Kirigal, which is published by a doctor who is practicing in our college. So in that, it was found that Bhusa Pinda Sweda was also practicing, and it is very much useful in Sarvangavada, Pakshaghata, and Ardita. So here it is a type of Ruksha Sweda, which I have already mentioned.
Yes.
Hello.
That is very clear, Krishna. So then the second thing was somebody has asked about Dhanyamlam, the preparation and all, but I think it is basically regarding the language because it is called Kanchigam, right?
Yeah, Amla Kanjiga it is.
So Amla Kanchigam is it? So when you said Dhanyamlam, I think a lot of people thought it was something.
Yeah, it is Amla Kanjiga.
Yes, it is Amla Kanchigam.
Yes,
I think that will answer the question.
Yeah.
Then somebody has asked about the Samsarjana Kriya. I think that you can simply just go through it because somebody has asked it. I think this, yes. So Samsarjana Karma.
Samsarjana Krama, it is done after the Samshodhana procedure, and it is mentioned that the patient will be having less Agnibala, and that is Payadikrama itself. Payadikrama is Samsarjana Krama. All the details are available in the classics, I think.
Exactly. And I think our book that the Chikitsa Sangraham,
Yeah, it is having.
That is available in most of the places. Otherwise, publication department can also, it is available for sale also there.
Yes,
it
yes.
contains a lot of such details. So general things, I think somebody can, anybody wants to know, they can just order the book. Then there is some Samsarjana Kriya, everything. Then somebody has asked, this I will also add on, the medicines used for Rukshana before Abhyanga. So that is a very basic sort of question. I think most of you will be knowing how we do Rukshanam before that Abhyangam with medicines itself. There are a lot of medicines which has got Rukshana properties. Like even simple Takram got Rukshana properties, isn't it?
Yes,
Dr.
yes.
Kumar?
Yes, yes, yes.
So such things can be given. The food, like when you are going for the Vamana or Virechana or something like that, after the Snehapana and all, whenever we do, the food is a very important part. So when you want to bring about the Rukshana, then you have to give some Ruksha sort of medicines as well as the food part. So Takram itself becomes one. Then there are a lot of medicines in Ayurveda, like the Shadharna Churnam is there. It is available in tablet form also. Vaishwananam is given, and certain kashayams can be given to induce that kind of rukshana in the body, such that it becomes ready for the oleation. Before the snehana, you have to make your body ruksha. So food as well as the medicine, both can be included. That is how. So medicines, I think all of you are doctors, you all know. But the thing is, this is the way we do it. So in certain cases, we ask them to take, buttermilk for a longer period, sakram. And then in certain cases, we start with Amrutotram and Shadharnam, Amrutotram Kashayam and Shadharnam, such things. In certain cases, we may be giving Vaishwanara Churnam at night. These are the way we bring about Rukshana. Dr. Krishna Kumar, would you like to add something?
No. Generally, Rukshana Karma done before Snehana Karma, it is mainly done just to enhance the benefits of Snehana. Generally, that is the main thing. Yes, yes.
So the question was medicines used for Rukshana before Abhyangam. So
Yeah. These medicines can, and even externally, I think we can go for Dhanyamlathara, or we can go for some sort of this.
Dhanya
Yes. All these.
Tanisha Swedam is another one.
Yes. All these things can be done. Yes. Okay.
Then somebody has asked for Panchakarma in paralysis management. I think the shloka itself mentions the Panchakarma. Pakshadhate Virechana. Right?
Yes.
So Virechanam can be done, and Virechanam it is not just here giving the medicine internally, even Shiro Virechanam can be included in that, in the Sutra. Yes. So would you like to comment on that, Dr. Krishna Kumar?
Yeah. It is mentioned like Snehanam, Sneha Samyuktam Pakshaghate Virechanam. So it depends on the patient. We can start with a Snehana Karma and we can end up with a Virechana Karma. Yes, we can practice.
Yes. And then about infertility. In infertility, the medicines are of course given. And in addition to that, we have to find out the reason for infertility. So whenever we find the reason for infertility, there might be an hormonal imbalance in certain people. In some people, it may be some other causes. So according to each cause, we can do it. And whenever we are doing it, your Panchakarma is actually basically to cleanse you out. So once you are cleansed, the medicines are better absorbed. We have our experience here. Whenever we are doing the Panchakarmas, like there was a case which I remember, I think Dr. Ramesh had said that, because there was some antibiotics and all which was not responding in a patient. And then gradually what happened, he came and had a treatment or this Panchakarma treatments here. The cleansing was done. And after the cleansing, then again the same antibiotic started working. So the thing is, the way the body absorbs a thing, that is changed. That metabolic cleansing that happens with this panchakarmas and the swedam, and after that vastis or virachanams, whatever happens, during those times, we find that the medicine efficacy is improved. Even when they are mentioning about the panchakarma, they say that it is just like your dyeing of clothes. You clean the cloth and then only dye it. That is how they mention it. So the condition is very similar to that. So that is one of the parts. So infertility, like you know about the medicines, like in certain things, palasarpis and such things are given. So internally also. So in certain cases, I think Uttaravastis are one things that we do in certain cases, but it is based on the patient. I cannot give you a vague thing for infertility. There may be a reason for that. Find out the reason, start treating for the basic things. So the panchakarmas which we use are one is that we are using it. That also, you know, somebody's.
I
got it. So that is how it is done. Then this is about habitual abortion. That is also something like missed abortions and all come because of your progesterone levels going down. So in such cases, it's better to give something like.
Sorry.
No problem. That's okay. So that is one. Then somebody has mentioned about Amavata Vata Raktam. So in every Amavastha, we go for Rukshana sort of things. And somebody had also mentioned about ankylosing spondylosis. In such cases also we do Rukshana initially. Like this Dhanya Pinda Swedam, that is with the powders, medicated powders one. Those things are usually used. Valuva Swedam can also be used. So these are the things which we use. And then we can do some combinations of this kiris. The potlis when we do, like we are doing that manjal kiri, which is a kind of rejuvenating sort of things for degenerative conditions, because manjal kiri contains haldi as well as the egg white, as Dr. Krishnomar Naik was mentioning. So when you are doing that, and sometimes you require, like in certain patients, you need stiffness. So we can add some Jambira Rasarasam into the manjal kiri. If stiffness is more, you can go for Jambira Pinda Swedam. But if you require the other part also, in manjal kiri itself, we can use the dravam or Jambira dravam, Jambira Rasam in manjal kiri itself. Similarly, when the pains are more, we can even go for ginger into it. So this combination can be according to your yukti. This potlis, swedams, externally when you're doing it, it is basically to for a particular purpose. So you have the idea of the purpose there. Then the dravam you can select. We here do even dhara with coconut water. So it is not just the Taila Dhara or Panchagandha Kshira Dhara or Dhanyam or the Kanchika Dharas, but even coconut water can be used. In simple Jaladhara can be used too. So a lot of people are using it. It is up to you to decide which dravam is required. Most of the dravam which we are using internally can be used externally too, with very good results too. So that is one of the things for Amavada, Vadaraktam. And in Sandhigata Vadam, naturally, when your swellings and such things are more, you will go for Rukshanas. Then if the stiffness is more, then you can go for Patra Potla Swedam. Then for regenerating or the degenerative conditions, you can go for Shashtika Shalipinda Swedam. In addition to this, you can use even Ragi. The Ragi can be used as because in cases where you don't require that kind of Brahmana in the body, so Shashtikam can be taken back. And Ragi is a very good rich source of calcium. So Ragi doesn't bring about that kind of Brahmanam inside the body, but for the bones it will be good. So that can be done. Similarly, when you're doing the potli swedam, that is the powder one, you can mix it in dravams. Like you can use Nimba Kashayam when it is skin related things. Like psoriatic arthritis are there. So in such cases also you can use. I think let me check for new questions. If somebody wants to ask something, they can ask also. PCOD management by Panchakarma. That I think we have already mentioned about it, because Uttarvastis can be tried, Vastis can be tried, like Ruksha Vastis, like Vaidyavani Vastis can be done. And in certain cases, we have even tried Avagaham with Vadahara drugs. So,
Hello, sir. I want to ask one question.
please do.
Yes. In lumbar L5, L4 and L5, disc bulging and nerve formia, nerve compression is there. Then what should be the Panchakarma treatment there? Line of treatment for first.
That is an important question. It depends upon how much compression and all, how much the patient is suffering. So
Patient is having numbness in thighs and burning feeling thigh region, and low back ache is severe.
Have you tried Prishtavasti sort of treatments, Kativastis?
No, did not tried any Panchakarma treatment. Firstly,
one thing is you have to reduce the abdominal pressure, because when you're the patient is constipated or is having a tight sort of stomach, the pressure is there. In most of the back related issues, if you give simple castor oil also to loosen up, then you find the pains are reducing. When Gandharvastha, the erendam given 10 ml, 15 ml before dinner, it itself has got a lot of therapeutic effects in such cases. Once that clarity comes, that the patient's stomach and everything is gone, then you can go for simple, patra potala swedam sort of things. But in certain cases, you have to be very careful. If pressure is applied, when pressure is applied, what happens is your that area might be, causing more pain in certain patients. In some such cases, we do the kativas, in which the patient can lie down on his stomach, and on that area you put some oil. I know everybody would be knowing about the kativas. I'm not explaining how to do it, but that can be tried. That itself has got a lot of effects on the sciatica sort of pain, because this compression and all, the whatever neurological symptoms you're mentioning, it is because of the compression part.
Compression, yes.
Right. So that kativasti can be done. And then, like when we were saying about the manjal kiri part, in that if you are using ginger or something, that inflammations it will reduce. So that also helps. And suppose this, you are saying about the disc, sometimes it is osteophytes which is causing the compression. In such cases, you can go for more nourishing sort of navarakiri or rejuvenating sort of things. That can be done.
Okay. Thank you very much. But in this condition, do we
about the
this
Vasti
is the
part?
Basti part.
I did not mention. Erandamuladi Vasti is something that you can try to cleanse it. Second thing is simple Madhudailikam can also be done, but that is not very specific. Erandamuladi is more specific in that. And then there is something like Dvipanchamuladi Vastis, with some amount of Mamsarasam is also added. When it is degenerative conditions, such things can be tried and it gives good results. Erandamuladi Vasti, we have found in most cases it gives wonderful results. So this is Vasti part. Virechanam can be given, and regular kind of small Virechanam with
yes, I gave him Eranda Taila to for this purpose only, but he did not shows any relief in pain and all.
Right with
so
Sahachara Kashayam or Sahachara Baladi Kashayam, give it in that, it might work out. Okay. And try Matravasti also if you feel the need for it.
Okay. Thank you very much, sir. Thank you. Okay.
Cervical spondylosis, migraine, frozen shoulder. I think about the Panchakarma part, if you're asking, Nasim is our choice Panchakarma in those conditions. Varicose veins. Yeah, varicose veins. Okay. He's suffering from pedal edema from 2 years. So you have to improve the circulation in this case, right?
We can go for
Where?
Rakta Moksha, I think.
Yes. So which? Yes, that Rakta Moksha part. Yes, Krishna Kumar ji, boliye.
Sir, I wanted to ask, like, for frozen shoulder, sometimes it's found in lean patient and sometimes the patient is fat type. So in Sam, Miram, like, so what is the difference of oil? Like, and even for Nasti, like, which, what are the different oils like in this two different species? What is the Nasti, like, for Nasti also, which are the different oils?
Nasya is I just said it in a general manner, but if it is a frozen shoulder where the inflammations are there, you can put poultices. Some medicines which can be made into a paste and put on that area and bandaged. That can be done. And small potleys like Karisha Pinda Swedam and all works. Manjal Kiri works very well. And if it is like some inflammatory conditions, you can use Lavana Sweda also.
And sir, if frozen shoulder is found in patient like who has a previous history of this herpes zoster, like in that area only.
You have to be careful there.
Yeah, so it becomes very like difficult, like because the patient
So
is
when
not
you are
very.
doing the poultices and all, you can see what all medicines you are using. Certain medicines you find are effective in the, both places. Like neem is very effective. Neem contains some, certain things which are like sulfur, which is good for arthritic conditions, but it's also good for skin-related issues and infectious conditions also. So that can be used. In Nimbadi Kashayam, you can do podikiri and such things. And then there is somebody who was asking about protocol. I would like to mention certain things like, even though we have a general sort of protocol, Ayurvedic Shastram doesn't go with the protocol. Each patient might be different. So if I say a certain thing, it might not suit a certain patient. So we just go according to each patient's conditions. Of course, we have a general sort of protocol in most of the cases. So, Krishna Kumarji, anything you would like to answer about?
So it is mentioned even for Panchakarma, it is mentioned Dushyam Desham Balam Kalam Prakriti Manalam Vayaha. We have to take all these things into consideration before starting the treatment of the patient. And it all depends on patient and dosha, dushya, and even kala. These all things have to be taken in consideration before starting the treatment.
Sir, I have a question. Hello.
Yes, please.
I've got lymphedema, like after surgery and chemotherapy. So my nodes are all getting swelled up with the fluid, lymphatic fluid. So anything for that?
I don't know what you call it in the black pepper. We have used black pepper pretty well. Marichadi Kashayams and all in such conditions pretty well. Bugulu Panchapalam works. Oil applications is not very good in such cases.
So what, these are oil or what? Pepper oil?
I'm not able to recall that. No, pepper, not oil. It is a decoction. You can make a decoction with pepper. Marijadi Kashayam. And there is an oil called Nonganadi Erenda.
Please, can you message me?
Of course. Arjun? No? That Nonganadi Erenda Thailam is one of the products.
Which Thailam?
Nonganadi Erenda. So Nonganam pulli is a type of grass which is particularly effective in such conditions.
Longanam.
Nonganam, I don't know what Panalware, right? In Malayalam it is called Panalware, right? Arjun or Krishna Kumar, like, can you help?
No, I think it's a sort of grass, I think.
Yeah, Panal.
No, not Panal.
Nonganam.
Nonganam is a type of
Nonganam
grass.
is a type of grass, yes.
So you get it in an Ayurvedic shop?
No, Ayurvedic, I think previously they were having this formulation. Now I think it is not available. I'm not sure.
Not available. So from where I can get it?
Usually we got some good results in certain paste applications. Panel in the Panel is just let me check it out.
और मुझे लगा करेला ज्यादा तो 4-5 रख देते तो दिन से यही करेंगे
Also pray.
Hello, sir. I have question.
और 3-4 एक नहीं आने करेला कड़वा नहीं और मेरा अच्छा वाला नहीं प्याज कितना डालो लेकिन करेला का पूरी कड़वा बनने को कम खाओ
Hello, sir.
Just a minute.
Hello. Hello.
Glycosmiss pentaphylla rutaceae, that is called that panel is there. That and pepper mixed together, put as an application, seems to be working on this kind of conditions.
Please, can you message this so that I can take a screenshot?
Chat box returned down, sir.
Okay, okay.
Sir, there is any solution in Ayurveda in
And from where I can get this?
That is a problem. It is a herb actually.
Okay.
Hello.
In our when we are doing this treatments and all,
Yeah.
we ask our the people who collect this to bring it, because it is only once in a while this lymphadenema people come. At that time, as and when required, we ask them to get it.
Okay.
Internal panic tracking, please. He's raised hand.
yes, I have one question that joint dislocation.
Thank you, sir.
There is any solution in joint dislocation problem?
Shivaji, you would like to answer?
Not properly.
No?
Hello.
You can answer that.
No, I didn't hear the question.
Sir, I have the question is joint dislocation, right hand joint dislocation. There is any treatment in Ayurveda in or Panchakarma?
Yeah, you can do one thing. Yes. Hello.
Yes, sir.
Okay, sir. So you can do one thing. You can have some Brahmana type of procedures. You can opt like Shastika Sweda or Lepa, and followed by some oil application. So this will nourish your muscles over that area, sir. I think that will be good.
Hello.
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 Excuse me, sir.
That is available in Kotakal Hospital in Kerala?
No, you have to go for a treatment center, sir. If you are going for a treatment center, you can do all these procedures.
I'm talking about this Kerala hospital, your Kotakal hospital.
Yeah. Yes.
Okay. There is permanent solution, na?
Good evening, sir. Good evening, sir. I have a question that what treatment could be done in Ayurveda for fibrosis in uterus and for brain fog? Hello. Fibrosis in fibroid in uterus and brain fog. Two separate conditions.
Fibroid in
Uterus. Yeah.
Okay, we do douche all. That is a kind of utravasti with a particular dravam. That seems to help, and some internal medicines are also given.
Internal
like
medicine.
Varanadi is there. It can be treated as a granthi.
Okay.
So Nimbamradadi Panchatiktam can be given, and in that you can, for bringing it locally, you can add Saptasaram or something like that. You treat it as that. And the second part was?
Second part was brain fog, confusion, inability to decide. Inability to
What is causing that?
Sanjay?
What is causing that brain fogging? Brain fogging is a symptom, ma'am. So some underlying cause might be there. Like it may be what is the age of the patient?
42 years.
How much?
42 years.
That is pretty early. So is the person stressed?
Stress is also a part of.
But it is also one of the symptoms of having exposure to COVID for a long time. Some of my
No,
patients,
COVID
they
is
do have
not
a
the
brain
reason.
fog.
COVID is not the reason here.
Okay. So the thing is, as she's rightly pointed out, COVID and even after the vaccination and all, a lot of people had complained of such conditions. In fact, and people who did not have any symptoms, they came
But,
up with a lot of.
if it is long term,
If it is long term, then you have to go run some tests on her, like why it is caused. Maybe some deficiencies are there, or you can ask them to do some pranayama sort of things, because in stress levels, when the stress levels are more, you find that your corpus callosum, that thing that connects the two brains, that shrinks. So based on that only you have to treat. In certain things like nasyams, medicines like brahmigridams, these things can be given.
Nasyam is already tried, and
With
it's
what? Nasyam was tried with what?
Nasyam was tried with almond oil.
Almond oil, okay.
Yeah, and after the stress was removed, she was out of depression. Then even these conditions continued.
Okay. Try Brahmi Tailam Tailadhara on the head, and after that go for an Nasyam.
Okay.
That might work out in certain cases. Give
Any abhyanga?
Abhyangam you can give, of course. And in certain cases, you can give internal medicines like Varavishaladi Kashayam, Brahmidrakshadi Kashayam. How is the temperament of the person? Angry or anger? Suspense?
Irritates if someone irritates. Otherwise, she is cool, and she is otherwise quite well. But if she has memory loss, kind of means she can't remember more things. She is forgetful, kind of.
She seems to be very close. You know her so well.
Yeah.
You know her so well about it, if she gets irritated, all those things, no? So
yeah.
So
I know her well.
So Brahmi would be a good choice. Brahmi, in the medicines with Brahmi. There is
But
a medicine
Brahmi
called,
is very dry nature.
No, not that. Like we have a product called Ginicot. It contains Brahmi, Vacha, and Shankhushpi. Three things, right? Arjun. That is more of a marketing thing. But anyway, the three things are there, and Jatamansi is also there. Ginicot seems to be working in such conditions.
Tried Vacha and Shankhushpi, Brahmi.
Shankhushpi, Vacha, and Brahmi. All three things are there in that medicine, Ginicot.
All three things are already tried, but these medicines called increase Pitta dosha to a they spike the Pitta dosha in her.
So you've tried everything.
Yeah, and it also increases the dryness in the body. Even the outer surface of the body becomes very dry, and you know.
Why don't you give it in ghee medium then?
Manasmitravati.
She is a little obese and kind of, you can say, sedentary kind of lifestyle. So I can't give a ghee
So you
based.
believe that the ghee makes you fat?
No, I mean to say that she takes ghee in her daily diet.
So that ghee you can reduce, and you can replace it with or medicated ghees like Brahmi or something like that. Parasodagradam, Brahmigradam. There is another thing like some Aarti Sharma is saying Kalyana Gradam. Kalyana Gradam is a good gradam. That is what I mentioned in Varavishaladi Kashayam. That is pretty good.
Okay.
That's a good suggestion, but the thing is you have to decide based on the patient's condition.
Yeah.
Hello,
In
sir.
Yes.
Sir, anything for varicose vein?
Yes, plenty of things, ma'am. Varicose veins.
So, like patient is suffering from pedal edema from 2 years, and she is a Kafaja Prakriti, little obese and sedentary lifestyle.
So what did you try in her?
Sir, no any Ayurveda treatment. Patient has tried allopathy medicines like anti-inflammatory drugs and blood thinners, but still not got satisfactory results and suffering from pedal edema and both leg pain.
Circulation improvement would be good in such cases. So
So any drugs can you suggest?
Drugs you want? Okay.
Yes, sir.
So Nimbamradadi Panchatiktakam, Punarnavasavam.
Punarnava also. And?
Nimbamradadi Panchatiktakam Kashayam is there.
So which kasai? Which kasai?
I didn't get you.
So please repeat the drugs.
Nimbamradadi Panchatiktakam.
Okay, Nimbamradadi Panchatiktam.
Okay. Mahatiktakam.
Okay.
Manjishtadi Kwatham.
Okay.
Punarnavadi Kwatham or Kashayam.
Okay.
Then
Aishwara Gugulu.
Aishwara Gugulu.
Yes.
Okay.
And what else?
So can you message me in chat?
Okay, you can just put a message. I think the marketing department will be mailing you back on that.
Okay, sir. Thank you.
Thank you.
Pranam, sir.
Namaste.
I had one question regarding Shiro Pichu itself. If you want to give a Shiro Pichu under 5 years of age for kids having epileptic fits or for any sort of mental issues like autism or like this or like Samriti, Dhriti, Bhransh also for memory retention also, for how long we can give Shiro Pichu to kids under 5 years of age? Hello.
Hello, Krishna Kumar, you can answer that.
Yes,
Shiro
sir.
Pichu.
I'm not sure. I think.
Yes, in our hospitals.
The age related thing, I'm not sure about that. We have to see the patient.
I think can be given to, because the child is 5 years. I think you
No,
can.
no, sir. The child is 3 years or 4 years of age.
No
under
problem.
5.
You can apply the oil on the head. You need not give it as a pichu. Even if you give it as a pichu also, we usually 14 to 21 days we have the patient here. We have not seen any untoward effects on the child. After 1 or 2 days, if he complains of certain things or he's a cold or something, we withdraw it. Otherwise, it is perfectly okay. We ask them to apply oil on the vertex and the head and all. No, usually.
No, it doesn't cause burning sensation because presently the madam asked a question about the brain fog. I have 3 or 4 kids in my clinic which used to have these sort of symptoms after getting long exposure to COVID. All the family members were suffering from COVID. After that, what happened is their immune system was gone, and the few of them, they had a febrile seizures and all these things, and one was diagnosed with autism also. So that's why I was asking about this Shiro Pichu, that how long we can give, because I have told the parents that you can give it is a very simple technique, and I have told them how to give that. So how long they can give? Actually, I don't have a practical data about that.
Okay, you can give the application of oil regularly for a longer period. Applying oil on the head is not contraindicated. But as when it comes to Piju is done as a procedure. You put a cloth dipped in this thing, and after 15-20 minutes we wet it. So that we do it as a treatment procedure. In our hospital, there are patients who are admitted for 21 days or so. All the 21 days, certain people are able to do that. If suppose they are developing some kind of cold-related symptoms or something, we stop it.
Okay, only during cold we have to stop it. Otherwise, we can give it.
Otherwise,
easily,
we can do it. Usually, it doesn't cause any problems.
Yeah.
It only stimulates the nerves.
Normally, it is written in Ashtanga Hridaya about Nasya also that it should be given from the age of 7. Can we start at early in such patients also?
Nasyam, actually, it is difficult to give in small children. Yes, I agree.
No, just 2 drops if we want to give like a Pratimarsha Nasya. Is it feasible to give to such a young children?
Usually doesn't cause, but it causes a lot of problems in the child. So one of the ways you can do that is you can do it as a dhupanam procedure. There are dhupanam procedures also mentioned in Apasmara and all. It is there also in children also in Grahabada. I think dhupanam is mentioned. So the medicines you can make it to the Varti pot thing and burn it little bit. You cannot give too much of it also, because when the burning is there, it may cause some kind of asphyxia also. So it has to be done very carefully.
Okay,
So
sir. Thank you so much.
With a 3-year-old child, I wouldn't suggest doing Nasyam or even Pratimarsham, because I found that it would be very difficult.
Okay, sir.
Sir, Brahmi and Shankhupi will work for indecisiveness also?
Now, these are all, very vague sorts of things. Like indecisiveness and all is a part of nature. So a medicine will not work. You can go for a clinical sort of counseling and assessment to find out why this is happening. There may be a history. So based on that only, don't go giving medications for every sort of symptoms. It usually doesn't work.
Anything in Panchakarma for this?
For what? Indecisiveness?
Yeah.
Well, Taptajya Ghadayoriva is something. So when it is the body as well as the mind is, so most of the, if you can find out which dosha is responsible for the indecisiveness, accordingly we can do the Panchakarmas.
Okay. Could you write the medicines you suggested for fibroid and this mental confusion and forgetfulness? Please write in the chat box.
Forgetfulness, I think a lot of medicines can be mentioned, but it depends upon the reason why this has happened, which will decide which medicine, which is the apt medicine for it. So I'll tell you a group of medicines which can be used. One would be Saraswata Arishtam, Saraswata Ghrutam, Genie Cot, Varavishaladi Kashayam, Kalyanaga Ghrutam, Mahakalyana Ghrutam, Panchagavya Ghrutam, Mahapanchagavya Ghrutam. All these things can be used. Brahmi capsules is there, Manasamitra Vadagam is there, Suvarna Muktadi used in a particular manner also works. Brahmi
Could anyone please write down in the chat box?
Okay.
So a few, if not all, few.
Sure. Arjunji, please type all those things.
Down yourself, nice, better.
Anyway, these things will be recorded, right? So you can, because if I start typing it, I may miss some questions.
Good afternoon, sir.
Thank you,
sir. Yes, I want to know what we can do in the bowing of leg and knock knees. Can we do something by the Panchakarma procedures in the bowing of legs after osteoarthritis?
Like rickets.
Yeah, one condition is after calcium deficiency and vitamin D deficiency, and bowing leg of is because of the post condition of the osteoarthritis of Sandhivat.
Okay, Upanaham is one thing. Upanaham with splints would be good idea to do that.
Upanaham by which Churna, sir?
Upanaham with you can use
Mas Rasa and something else with the
Mamsarasam is okay. Mamsarasam is okay, but methi, methi, shata hua.
Yes.
All those things can be used for Upanaham. Upanaham Churnam is there in Shushrutam, I think.
Yeah, we have that. And what about the specific oils we can use in the bowing of leg? Is any Lakshadi oil and any other oil?
Oil is there. Murivanna can be used. Rasa Tailam, Mahamasha Tailam. These things can be used. Valiya Prasarini Tailam. If you see the Palasruti, you will find that it is pretty good.
Okay.
Valiya Prasarini Tailam.
So Januvasti is a good option, or a
For osteoarthritis, yes. For
or Dhara is
osteoarthritis, Januvasti is
which
a good
one
option.
which one will be better option for the bowing of leg? Whether we should go for the Januvasti or we should use local Dhara for that?
Januvasti is good if only the knee joint is involved. But if the whole leg you are having something, addressing the whole leg would be a good thing. So Dhara can be used. So initially, as Dr. Krishna Kumarji was telling, it is Dhanyamla Dharas are usually given, and then we go for the Taila Dharas. That is how we do it. And then Navarakiri locally also can be done in such conditions. Navarakiri, I mean to say the Shashtiga Pinda Sweda.
Yeah, Shashti Jali Pinda Sweda with the Bala Kashaya. Yeah.
Yes.
Not only Bala, you can even use Sahachara Kashayam also.
Okay. And sir, what about the knock knees?
Knock knees. Okay. Those are all degenerative conditions, right?
Yeah, yeah.
So,
That's why the patients come to us only these things which are not curable by the allopathic one.
So I don't think even we are not able to cure that. We only manage it to a certain extent, and the patients are usually satisfied with that itself.
You can use
Because once the
Chandarpara
degeneration
Lakshadi tail for Matravasti.
Dhanvantaram Medupagam Matravasti in degenerative condition, you can even give a Tiktaka Gridam also. In Astikshayam, they say Tiktaka Grida Shradam. No, what isn't it?
Tiktaka Gratam Panam, na? Google
Vasti also.
Oh, Vasti also.
Kshiravastis with Tiktaka Shrada Kshiravastis. That is mentioned in
Kshiravasti.
Astikshayam.
Okay. Dhanvantaram Medupakam we can use for Anuvasana, and Panchatikta Kshiravasti as another one. Okay.
Yes.
Thank you, sir.
Thank you.
So it has been a wonderful discussion. I think time.
Sir, one last question, sir.
Overboard, I think.
Nastya for melasma.
Yes.
Nastya for melasma.
Melasma. Kungumadu Tailam.
So how many days like we can give? Say it's very strong, no, sir.
Beg your pardon?
It's very strong. So how many days we can give like so? It's
Well,
very strong.
Nasyam usually, if you are doing a Swadhimaksam, you can do as long as you want. But if other ways, 5 or 7 or 3, I think Krishna Kumarji will tell you more about how many days you should do Nasyam.
No, that all depends on patient, madam. I think simple Nasya we can't, apart from simple Nasya, we can go for some Lepana also. So Lepana like abhyanga, that all things we can club with Nasya Karma. That may give some result, and even go for some internal medicines also, which is Twachya, we can go for that also.
Okay, sir. Thank you.
Good evening, sir. Like, can we use any specific medicines or any procedure for coronary blockages, or to dissolve the blockages?
Coronary blockages. Yes, we have a lot of herbs which are good for reducing that kind of blockages. Like we have to give something that opens up the srodhas, right? So Rasonadi Kashayam, Rasona, things with Rasonam, things with Gugulu usually help a lot.
Okay. And if it is associated with pedal edema, can we give this
Pedal edema is
Punaravastika?
Punarava, yes, you can give.
Okay.
But pedal edema is maybe because of your cardiac issues, right?
Yeah, cardiac issues, and also the patient has more of like night cough, which is associated with more of kapha symptoms, I'm guessing, sir. She's having more chronic cough during the night times and unable to sleep also.
So Dashamula Haritaki, you should keep in mind. Haritaki has got a good effect on such conditions. Abhyanga.
Okay.
That is good for Shofam also, as well as in certain cases that.
Dashamula. Okay, okay. Rashanula, Elena, Rasona, and for
Few things. And then there is something called, in Brahati, there is a certain medicine which is pretty good for that.
Okay. Brahati and Kantakari, like for the cough. Vasa Kantakari and
yes, Kantakari.
Okay, and like Sitofaladi and Talisadi can't be given to this patient, sir?
If she's not diabetic and all, there is no harm. Anyway, you are taking it in very less quantity. Have you tried our Vashakot syrup?
No, sir. Vasa, yes, Vasa have given.
So Vashakot syrup is there. Ayurveda Shala has a product called Vashakot. It is available in sugar-free as well as with sugar medicines. So that also can be tried. It gives very good results. 2 or 3 times you give it. It is soothing also, and it can be given to anybody.
Okay, okay. So, like, can we give only Ayurvedic and just taper the allopathic drugs for the coronary blockages?
Yes, we usually give it, and then gradually it improves. We give a combination of a lot of medicines.
She's been on Ecosprin, aspirin, and clopidogrel and everything, sir. So we can reduce that medicines and start with this medication. Yeah.
Okay.
Nishant sir, I think we can wind up the session because
yes, Dr. Garje is asleep.
There has been a wonderful discussion. So for whoever is asking for the recording of this session, you don't have to worry. Already this is being recorded and it is being live streamed through YouTube. So that after we close the session, it will be uploaded on YouTube. It will be there. The link for which is already shared to Vinayak, the marketing you. So just contact him. Send that to you. Okay. So this has been a wonderful session. I think due to the time constraints, I think we will have to close the session because after 1 hour of class, I think almost more than 45 minutes of discussion has been going on.
Please share the YouTube channel.
Now we do have a YouTube channel. The link for the same has been. I will do something. Right now the
put in the chat box or. Could you please put up in the chat box or the Telegram group?
I'm doing it right now. I'm doing it right now in the chat box. This live streams link is being put up so that you can go to that. After this, you can watch and learn at your leisure. So that can be done. In the chat box, this is I am putting it up. In the chat box, you can find the link. It's visible to everyone. Please copy and paste the link right now itself. And if you have any further queries regarding our products, marketing at aryavaidyashala.com website, that is our official mail ID. I am sharing that mail ID in the chat box again. Marketing at aryavaidyashala.com. You can just copy paste that one too. So please check the chat box. The mail ID to contact marketing is marketing at aryavaidyashala.com. Please do not flood the chat box right now, so people will get confused. Anybody don't put anything in the chat box right now. There is marketing at aryavaidyashala.com, and there is the link for this session that has been already shared in the chat box. So please copy it down. And I wholeheartedly thank Dr. Krishnakumar Naik and Dr. Nishant for being here. That was a wonderful session and there was a beautiful discussion. Hope you had some use out of this. Your further questions can be again put into that mail. It will be forwarded to whoever is concerned, and you will get an answer. You don't have to worry. Okay. Hope this was useful. Hope you will start thinking more about Ayurveda and you start using it. If Dr. Nishant or Dr. Krishnawat want to add something, you can please add. Sir, I think after this we will be session. Dr. Nishant.
I think I've had a wonderful time interacting with you all. It was nice to meet so many doctors who are so keen and practicing Ayurveda. I hope you continue doing so.
Exactly.
And be friends with topical. Our medicines are always there for you.
Yes.
Thank you.
Kumar Naik, thank you. If you have anything to add, you can add, and we can close the session.
No, of course, Arjun, it was a wonderful session, and having this much of participants who were very much energetic in asking questions. It was a wonderful experience. Thank you.
I think I'll be closing the session right now. You can everybody can log off. Again, we will be conducting the sessions like this. Thank you for your wholehearted presence here. Thank you once again. Thank you.
Thank you.
Vidishala. Everybody can please log off. Thank you.